What are alternatives to quetiapine? If you or someone you know is considering alternatives to quetiapine, you are not alone. Many people seek options for managing mental health conditions while being mindful of potential side effects and dependency issues. Quetiapine is an atypical antipsychotic often prescribed for bipolar disorder, schizophrenia, and major depressive disorder. However, there are several alternatives that may suit individual needs better. One alternative is aripiprazole, commonly known as Abilify. This medication is used for similar conditions and tends to cause less sedation and weight gain compared to quetiapine. However, it may lead to insomnia in some users. Another option is lurasidone, also known as Latuda. This medication is effective for bipolar depression and schizophrenia, but users may experience side effects like sedation and nausea. Risperidone or Risperdal is another alternative. It treats bipolar mania and schizophrenia, but it can cause weight gain and dizziness. Olanzapine, known as Zyprexa, is also used for bipolar disorder and schizophrenia. However, it is associated with sedation and increased appetite. Brexpiprazole or Rexulti is another choice, often used as an adjunct in depression and schizophrenia, but it may lead to weight gain and fatigue. In addition to these atypical antipsychotics, mood stabilizers can also be considered. Medications like lithium, carbamazepine, oxcarbazepine, and valproate can help regulate mood symptoms without the antipsychotic effects of quetiapine. These options may be particularly beneficial for individuals with a history of substance abuse, as they often have a lower potential for misuse. When discussing alternatives in the context of substance abuse and addiction, it is important to note that quetiapine has been misused due to its sedative properties. Therefore, choosing medications with a lower risk of dependency is essential for those with a history of substance use disorders. Some atypical antipsychotics may even help reduce substance use in patients with co-occurring disorders. In drug rehabilitation settings, medications like methadone, buprenorphine, and naltrexone are used to manage opioid and alcohol addictions. While these do not replace antipsychotics, they specifically address substance dependence. Antidepressants and mood stabilizers may also be used alongside or instead of antipsychotics based on individual diagnoses and treatment goals. Medication is just one part of managing mental health and addiction. Therapeutic interventions, lifestyle changes, and psychosocial support play a significant role in a comprehensive treatment plan. These approaches can reduce reliance on medications like quetiapine and its alternatives, potentially lowering the risk of side effects and misuse. In summary, alternatives to quetiapine include other atypical antipsychotics such as aripiprazole, lurasidone, risperidone, olanzapine, and brexpiprazole, as well as mood stabilizers. When considering these options, it is essential to balance effective symptom management with minimizing the potential for misuse. A healthcare professional can tailor treatment based on individual needs, side effect profiles, and addiction history, often integrating medication with behavioral therapies and support systems.